Hello,
Hmm?
my name is Christian. Today I'll be doing an assessment on you. Before I begin, can I get your name and date of birth?
Yeah, my name is Hector Alexis Sabella, date of birth November 4th, 1993.
Okay, so do you know what we're here for today?
Yeah, we're here. I think you're gonna do like a muscle assessment thing.
Yeah, okay, so first I'm just going to start by asking you a couple questions before I move on to the physical assessment part of it. So, have you had any recent weight gain?
No,
Do you have any difficult chewing?
no,
Any joint muscle or bone throbbing?
no,
No? Okay. Now I'm moving on to past history. So, any past problems of injury to joint muscles or bones?
no,
No? Do you have any past treatments like surgery, medication, physical therapy? No?
nope.
Any tetanus or polio immunization? Do you
No.
have them? No? Diagnosed with diabetes mellitus, lupus, or sickle cell anemia by any chance?
No.
No? How old started? Oh wait, not that question. Not bad. That one's a question for females. Family history. Do you have any history of rheumatoid arthritis?
No.
No. Any gout?
No.
Osteoporosis?
No.
Any past history of cirrhosis?
No.
Or infectious tuberculosis? No. Now I was just asking about lifestyle questions. So the first question is, do you do any activities that promote musculoskeletal health?
Yeah, exercise.
Okay. Any home remedies to relieve musculoskeletal problems? Have you had any?
No, I don't do
No.
those.
Any assist devices promote mobility, like
No.
crutches or no?
I walk fine on my own.
No. Do you smoke?
No.
No. Any alcohol or caffeine beverages?
No, I don't do that.
Can you describe your typical diet? Drinks, milk. Do you take calcium supplements?
Oh, I mostly eat fruits and vegetables. I don't eat a lot of meat, so I guess I'm mostly vegetarian. I drink mostly water.
Okay, and can you just, if this is too personal, what's your occupation?
I'm a student here,
Student?
Fresno.
Do you know, like time in the sunlight, how much you spend a day or per week?
Not much. I'm mostly indoors.
Okay, you routine exercise?
Yes.
Yes. Do you have any difficulties with ADL, which is like activities of lifestyle? Like
No.
Your typical posture, like are you always slouching, or you stand up straight, sit up straight?
Pretty upright.
Is there any interference with sexual activity? No. Abilities to interact or socialize? No. Do you have any body image like disorders? No. Any stress in your life right now?
No.
No. Okay, now I'll be going on to your the actual physical assessment part. So for this, I'm gonna put on some gloves and go ahead and like palpate and just inspect. So first, I'm just gonna have you. I'm gonna assess your gait. So if you can just walk like let's say like 5 feet forward and just back. Just stand up and walk that way. And you can just come back. Okay. His gait is good. Next, I'll be assessing your temporal mandibular joint. So for this, I'll just have you. I'll be inspecting it and palpating. So inspect it, see nothing out of the ordinary. Just palpate it. Can you open wide? Can you bite down? Can you like move it side to side? Okay. If the temporal mandibular joint is good, range of motion is good. Next, I'll just be assessing your spine. So I'm gonna assess and I'm gonna palpate and do your cervical first. Okay, I'm just gonna be moving down, just filling the whole spine, so that's anything out of the ordinary. Okay, spine, the palpation was good. I'll just go ahead and assess your cervical mobility. So I'll just have you move your neck around side to side, front and back, and just give me a circular motion. Okay, that's good. Next for I'll be showing your motion of your thoracic and more of your lumbar. So I'll just have you go stand up or just sit up.
Sit up.
Yeah, sit and just go side to side. Just go like one side, other side. Okay. Range of motion of the thoracic and lumbar spine are good. Next, I'll be assessing for any leg or back pain. So I'll just have you lay down flat. I'm just gonna push your leg up to as far as I can in your chest. Do you feel any pain? No. If I did the other one, you feel any pain?
No.
No. Okay, so you go ahead and sit back to normal. Here, next I'll be assessing your shoulders. So for your shoulder, I'm gonna have you stand up again. Sorry. I'm just gonna inspect them and palpate them. Then for range of motion, I'll just have you go in circular motion, go the other way, okay, and then just push them back and push them forward. Okay, so that's good. Sit down. Go ahead and sit down. So range of motion is good for shoulders. Next, I'll just have you stick your elbows with your arms out. I'll just be rotating to inspect your elbows first. Palpate them. Okay, now just for range of motion, just have you do this, do this. Do you feel any pain?
No.
No. Okay, so range of motion is good for the elbows. Next, I'll be assessing the wrist. So for the wrist, just have you go in circular motion. Go the other way. Did that hurt at all?
No.
No, I'm just gonna go ahead and inspect, palpate. Does any of that hurt?
No.
No? Okay, so that's good. Next, I'll just be doing the carpal tunnel inspection. So for that, I'll just have you do this right here. Okay, so I'll just wait for, I should be waiting for a minute while he does this. You feel any pain while doing that? No? Okay. Alright, I'll just say the minute passed and the patient shows no signs of carpal syndrome. So next, I'll just go ahead and move on to the hands and fingers. So for the hands, I'll just have you stick them out. I'm just going to be inspecting them first, palpating your hands, and palpating your fingers. Okay. And for the hands, just like close them, open them, move your fingers in like this, out, and then touch your thumb with each finger. Okay, so range of motion is good for the fingers and hands. Next, I'll be doing your hips. So for this one, I'm just gonna inspect your hips. I'll just look at one side, palpate. Do you feel any pain? No? Okay, so hips are good. And for the range of motion, I'll have you lie down once again.
I got.
And then we already did the whole front and back, so for the next part, I'll just have you move one leg over the other. So just do this. Feel any pain?
No.
No? Go ahead and do the other one. Good. Any pain?
No.
Okay, so range of motion is good on the hip. You can go ahead and sit back up. Okay, so for your knees, I'm just gonna inspect your knees first. Looking to see if there's any sort of redness or warmth to them. No? Palpating. You didn't feel anything out of the ordinary?
No.
Next, I'll be testing range of motion. So for the knees, I'll have you. I mean, we already know that the range of motion is good because he was able to bend the knees a little bit across his torso along with. I mean, for one, we can do it one more time. Just go ahead and hit outside. Okay, just gonna grab your leg up and just. Any pain?
Nope.
No. Let's see one more. Any pain?
No.
No. Okay, go ahead and sit back up. Okay, so now range of motion is good. Next, I'll be doing a bulge test. So for this, I'll have to like sweep, feel to see if there's any noticeable bulges on either side of the knee. Let me see. No noticeable bulges. So that means I wouldn't have to move on to the allotment test. Next, I'll be performing Murphy test. So for that, I'm gonna have you lie down again. Sorry, I mean, you lie down so many times. So for this, I have to grab one knee, put one hand right here, grab the foot, and kind of like move it like this. Just go along with what I do. I don't feel anything out of the ordinary. Okay, next I'll be doing the other one. I'll be just feeling the knee. Okay, and so there's no signs of any torn ACL or any ligaments right there, so you go ahead and sit back up. And last, I'll just be going over your ankles and feet. So for this, same thing, I'm just gonna inspect and palpate your ankles and palpating your feet. See if I notice anything odd. Ankles, going and feeling your feet. Don't feel anything. There's nothing really that's seems abnormal. So after that, I'll just have you stick your foot out and rotate. You can rotate the other way. Do you feel any pain while doing that?
No.
No? Okay, so musculoskeletal is good. There seems to be no abnormal Things found. So, do you have any questions? No. Okay. This concludes our musculoskeletal assessment. Thank you for helping.